As clients, Dr. James Chan, the cosmetic surgeon.
I know, Dr.
extraordinaire.
Chan, that Mitch would like you to grow some facial hair because he's like always, he's so young.
When your boss is younger than you, and then your doctor's younger than you, it's bad.
Maybe
But
if
I mean,
you just like burn a cork and put on some hobo stubble.
Yeah, he really does have the skin of like a 7-year-old.
Yeah, that's not right.
It's quite something.
Do you do stuff on yourself?
I do. I get a lot of stuff done in my office, skincare, facial stuff, and also just the injectables, Botox, Xeomin.
Because you do not have a wrinkle on your forehead.
No. And your skin is, do you use Obagi? Can I ask you?
I don't use Obagi. We have other products I use. We have Topical Healing, which is a great product. I also use some of the Elta sunscreens that we have. So I use some of the other stuff.
See, now I'm looking real close. I'm going to make you like uncomfortable because I'm going to find...
There's nothing there.
Find one big pore. Anyway, we're not here to flatter James Chan up and down the wall. I have a question for you, and if it's something you don't know about or can't talk about, that's fine. But I just saw this today, and Mitch and I got very excited.
We're fans already.
Yeah.
Maybe stockholders.
I don't even know how I
stumbled
onto this. Yeah, I wasn't looking for anything like it, but there's this there's a group called Kythera Biopharmaceuticals, and yesterday their shares went like through the roof because they have this thing. It's called ATX 101. Have you heard of this?
I have not.
Okay, well, let me tell you about it because you might be interested in it.
Yeah.
ATX 101 is used to treat double chins. They said that the drug it destroys it creates the appearance of a no double chin because it destroys fat cells and leaves the other tissue largely unaffected. They had very, very few side effects, and basically, like, all their trials were like, yes, it works, and people were like, ah! So my question is, what can be done for a double chin? Can you liposuction under a chin?
Yes, you sure can. What this product sounds like, it's some sort of injectable product that is a lot like what we call mesotherapy, and it's got a kind of a checkered past because it has caused some problems. It causes a lot of scarring in that area. That's how it melts the fat, and you can get a lot of permanent changes that you can't reverse. There are a lot of other proven, much safer ways to reduce a double chin.
Like what?
Liposuction is a great one. We've talked about adding Ultherapy. Ultherapy is a great way to tighten and make that double chin go away.
There are some before and after pictures on your website of double chins that go away.
You're really good at lower face lifts.
Really good.
Like crazy good.
Yeah,
Yvonne, is he crazy good?
Crazy good, I have to tell you.
Yvonne's Dr. Chan's office manager.
Lower facelifts. Is that what they're called? Lower facelifts? Like,
yeah, a facelift really is a lower facelift.
Okay. That's right. And an upper part is a brow lift.
Brow
right?
lift, correct.
They make a dramatic difference in how old you look.
Absolutely. In the right patient, you can really make a big difference. I mean, it sets them back, 10, 15 years sometimes even 20 years.
And do you have a pretty good idea with the patient if you liposuction?
Right now, I should mention that Mitch and I are clawing. We're clawing at our own chins.
Because if you suck the fat out, there's a chance, depending on your skin elasticity, what are you going to do with the skin? So then you would need some type of a lower facelift. Is that accurate?
Right. Sometimes if you're in that age group where your skin's not going to bounce back, you may need a lower facelift to take up that extra skin. But in some of the younger patients, we have Ultherapy now, which is a great addition to the liposuction because it helps contract that skin.
Yeah.
Okay.
But could you put in there before retracting the skin? Could you put maybe an inflatable in so you could blow your
like
chin
a bullfrog?
Up like a frog?
Why would you want to do that?
Love that.
I hate bullfrogs. I hate big chins. No.
That's not on trend right now.
No, not at all.
Tell us about Ultherapy because it's kind of a new thing, and we've sort of mentioned it in the past, but you actually know what it is and what it does.
Yeah, it's focused ultrasound, so it's very safe. It's based on technology that's been around for a long time. But what that focused ultrasound does is it creates little thermal injury zones underneath your skin, which then when that heals, it creates collagen, gives you a lift.
How long does it take to heal?
It can take anywhere from 3 to 6 months for that collagen to reorganize and to produce.
But you don't see anything while that's going on, and you don't really feel anything.
No, there's absolutely no downtime with this. So you can do it, go back to work that same day.
So for the double chin, would you do the lipo first and then the therapy, all therapy?
We usually do the Ultherapy first, and then we do the lipo right after that. You can do it at the same time.
Interesting.
Yeah.
Where else can Ultherapy be used on the face?
You can use it on your whole face, so the mid-face or the cheek area, as well as the brow area.
Wow.
That's crazy.
I'm liking it.
Are there any topical creams or things that do their purported claim of like lifting and tightening skin, or is that?
There isn't a lot out there that works effectively. Retin A probably is the best thing out there. It's the one that's been studied the most, and it actually does reduce wrinkles and changes the collagen in your skin.
I thought that was used for acne.
It's used for acne, but it's also used for anti-aging.
Oh, Retin A, is there anything you can't do?
We love you right there.
Okay, so we're doing a little video here as we speak to put on our website so that you can watch and you can look back and you can see how sweet and cute Dr. Chan is. But then also we're going to see you do a procedure right now, and that's going to be on Yvonne. Tell us what you're going to do and what you're going to do it with.
Yeah, so we're going to be using something called Xeomin. Xeomin's a competitor to Botox. It works exactly the same, and it's been out just since the beginning of the year, and we've been trying it in our practice. It's a great product. I've used it on myself, and in the next month we're going to be running some promotions on it, so I wanted to introduce it here, and I'm going to be doing a little demo on Yvonne. We're going to inject her glabella area, or these furrows between the eyebrows.
The old 11s, they call them, right?
old
Yeah,
11.
the
Yeah, I got
Okay.
the big 11s.
But just for a second, Mitch's mom is the uvula area.
Thank you, Ted. Thank you. On behalf of my mom.
If you want to get a visual of Yvonne, I think she looks sort of like 60s. She looks like Sharon Tate a little bit.
Definitely
And
got that look. Yeah.
Okay, so you are cleansing the area with a swab. You've got your gloves on. You've got a little vial. Now it looks like it's just it's like a very small needle and applicator, and it's barely anything in there. I mean, it's just like a
25,
teaspoon.
25 units.
Yep.
Yeah.
That means
and
nothing to
I
me.
like the eyebrow arch, and so Dr. Chan's really great at knowing where to place it based on what you would like the effect to be. It's awesome.
And what do you want the effect to be?
I like the eyebrow lift.
You can do that with Botox.
So you combine that with Botox and Ultherapy, we got you covered, or Xeomin. Yeah.
We didn't know that.
Now you do.
Huh.
I just want to go in every week, just be like, do the latest thing.
Right. I'll be your
We'll
guinea
see.
pig.
Sometimes I'll love it, sometimes I won't. Don't care. Just keep doing it
Do more.
That's right.
till we get.
So this is Xeomin. Xeomin's great. It's, like I said, it's exactly like Botox. It works exactly the same. One of the benefits, though, is that it's slightly less expensive
Oh,
because
cool.
it's a competitor. So they price it a little bit lower so that they can get some of the market share.
And how long does it last?
It lasts the same, about
Okay.
3 to 4 months.
All right.
Everything else about it's the same.
So when more people introduce stuff that's like the same thing under a different brand name, that's just got to lower prices down for the thing.
Exactly. When there's more competition,
To be
it
scientific
naturally-
about it.
Brilliant.
Naturally lowers the price.
Okay, go to it.
Do it.
All right, here we go.
All right, going in.
Da, da, da. Okay,
Clean.
Yvonne's raising her eyebrow. Now she's lowering it and relaxing her face, frowning slightly, and in goes the needle, just like that. Yvonne hasn't even changed an expression. She didn't
Oh.
even give a blink or anything
Such
like
a
that.
tiny needle.
It's so tiny. It's tiny and cute like you, Dr. Chan.
He's not tiny.
Right now, he's on about his third injection. And then how long, Yvonne or Dr. Chan, will this take before we see results in Yvonne's face?
So it usually takes about a week for you to see the results.
Just like Botox. Very
Yep.
similar. Yeah.
Exactly like Botox. Yeah.
Some of the response has been that patients notice that it reacts quicker than Botox. Whether that's true or not is who knows.
Do you
Yeah,
have more movement with it than Botox, or about the same?
No, it's exactly the same. It's a little more pure of a protein. So in some patients who they find that the Botox doesn't work anymore, there's speculation that maybe because this protein's a little more pure, it has less proteins around it, that there are less antibodies, so there's less resistance.
Wow.
So if you haven't responded to Botox or you're losing your response, try Xeomin.
Okay, how do you spell it?
Yeah, good
So
question.
people know what to ask for.
Zeomin.
All right.
There you go.
I think I'm going to be trying some.
Sorry, it's Xeomin.
It's tricky.
Jimmy.
It's tricky, I'm telling you.
You can visit Dr. James Chan's website by linking via our website. You can see videos of him on our Buzz webpage.
Right, as well as this video that we're shooting right
And
now.
check him out online, drjameschan.com. Okay, so Yvonne, thanks for coming in today.
Oh,
It's
my
amazing.
pleasure.
You look,
Thanks, you
your whole
guys.
face has been transformed. You were hideous when you walked in.
I know it. Can
And
you
now
believe
you're
it?
like a
Well, this
Disney
is why I
princess.
tell everybody I have to keep working for him for the rest of my life, honestly. Yeah. What's a girl to do?
We'll be back after this.
Thank you.
Thank you.
Thank you.